Hi everyone, my name is Sarah Moon and I'm a clinical behavior specialist in BCBA in the ABA and Autism Service Program at Easterseals North Georgia. I'm here today to talk a little bit about developmentally appropriate behaviors in young children. All children use behavior to communicate. All behavior is some form of communication, but sometimes it can be hard to tell what's typical and what might need a little extra support. Let's talk about what is developmentally expected, what happens when you need to take a closer look, and how you can help. So, between the ages of 12 months and 3 years, children are learning how to express themselves, regulate their emotions, and interact with the world around them. Some common behaviors at this stage include having tantrums when frustrated or overwhelmed, testing limits by saying no or ignoring your directions, engaging in repetitive play like stacking, lining things up, or fixating on favorite toys. Some behaviors might signal that your child could use a little bit of extra support, especially if they are having difficulty with communication, social interaction, or managing their emotions within the environment. Signs to watch for include limited social engagement, like not consistently responding to their names or avoiding eye contact, delays in communication, like not pointing, gesturing, or using words to express wants or needs, or unusual repetitive behaviors like spitting, flapping hands, fixations on objects far or really close. Um, because behavior is a way of communicating, and behavior is always trying to communicate something. Even when words aren't there yet, we really work hard to acknowledge that this child is trying to tell us something. Many behaviors that we find challenging happen because a child is trying to get a need met. They might say, "Look at me," or hit in an attempt to get your attention. They might say, "I don't want to put on my shoes," or run away when it's time to get dressed to avoid doing something. They might engage in spinning, covering their ears, or avoiding certain textures because they are seeking or avoiding a form of sensory input. Or they might run and scream and hit and engage in those big tantrum-like behaviors when a routine changes. If you're seeing behaviors that are challenging, here are 3 simple ways to help. Number 1, name what's happening. Number 2, offer tools to communicate. Encourage that point, that gesture, use a picture, model language. And number 3, create predictable routines. Consistency can help reduce stress. Every child is different, and behaviors have many causes. So if you're unsure, don't be afraid to ask for support. Understanding behavior is the first step in helping your child thrive.